We're teenagers. We know that we have our own voice and that it's not just the adults who know everything, that we also know things and that we can work with adults instead of having to have a back and forth.
Younger generations, not always adults, can help when it comes to problems that everyone has.
Listen to the students, listen to them, understand them.
My overall goal for this initiative was to identify and develop policies in collaboration with youth and partner organizations that would eliminate some of the health inequity that Black youth experience.
We landed on an after-school setting, a school-based setting, as well as a mental health resiliency clubhouse. And so ideally what we were looking for is to implement something that would better support or promote Black youth mental health.
I saw this as an opportunity to look at policy as a proactive tool for preventing crises or creating spaces that make youth feel comfortable, feel loved.
An initial hope was really making sure that we were not only making the project come alive, but that we were really doing it alongside young people. I think that was well established.
Historically, there's been a lot of silencing of Black voices. So to amplify the youth's voices now gives us a chance for the next generation to have better mental health and build a greater world out of that.
And specifically being at a historically Black college and medical school, that is the number one priority for us. It really isn't difficult for youth and adults to share power.
Creating a space for them to share their own experiences or share how they think that the systems could be leveraged to better support them is ideal.
I would definitely say there's been a few challenges that we've had to overcome. Definitely communication and finding out the best ways to communicate with adults and youth. And also timing. Scheduling was a big thing throughout this entire project. Finding times that were accessible for youth and also adults.
Also, another barrier of resources. Resources matter so much when it comes to mental health, even if it's just coming down to having a space and the time, not just for Black youth, but for all youth and for all people to thrive. We need more resources just across the board.
One of the most inspiring moments was actually at the very end. So one of the mental health and wellness activities was a mental health summit that we hosted in Albany, Georgia. And it was at a clubhouse when one of our youth leaders was reflecting once the event had ended with a local youth leader. And so that was really powerful because to see and witness kind of that peer-to-peer interaction was really, really cool. And this particular youth was a little nervous stepping into some of the leadership roles that were required, but got some really good support from the implementation youth leaders. And so to see that kind of interaction and engagement was really something special.
I am very proud of the results and to see the policy that we chose. For it to be implemented in 3 different locations in different ways was amazing to see.
I think one other really important aspect is around the partnership and collaboration, bringing the partners that we did into this project and recognizing everyone's expertise. What we were able to do together in this project with these groups of partners was not something we could have done by ourselves.
Whenever you're assembling your team, if you're going to do this work, you need people that are passionate. No matter the sacrifice, you need people that are passionate about the work because passionate people are the people that are going to get it done.
This video was commissioned by Morehouse School of Medicine with funding from the federal government and produced by a youth producer at VOX ATL.